Okay, this is Alex Eaton, RN, and I'm doing an abdominal assessment video. Today I'm working with my preceptor, my clinical instructor. This is a requirement of the class, so I'm going to do this focused abdominal assessment real quick, and then we'll finish it up. Okay, so obviously we're at Mercy Hospital here in St. Louis, so we're not going to disrobe. So this is going to be a simulation, okay? Because we're in a break room out of a patient area. Okay. The first thing it says is we're going to inspect for the coloration of skin, vascularity, striae, scars, lesions, rashes, symmetry, contour, movement with respirations, aortic pulsations, and peristaltic waves. Okay. So by observing Miss Leanne Glass here, I can tell that her chest rise is even and falls, and I can look at her abdomen, and I don't see any abnormal breathing. I don't see any abnormal pulsation waves. She's not guarding any part of her anatomy. Just by looking around in the neck area, I don't see any abnormal skin, vascularity, striae, scars, lesions. Her contour is normal, to be expected for her age. She's not thin or emaciated in any way. Her umbilicus looks normal. She doesn't, like some people have a herniated umbilicus. She obviously has a normal umbilicus. Okay, so next you asked me here to also take for bowel sounds, vascular sounds, and friction rub over liver and spleen. I know how to do that. So.
Oh, sorry, Chris. You come in. You can go
Okay.
back.
Okay, so I'm going to also tape for bowel sounds here. I'm going to right upper quadrant is good. Upper quadrant is good. Leanne's working today, so she sounds hungry already. Okay, that's good. And left lower quadrant is good as well. Okay, and then I'm going to listen over the liver. Listen for any friction rub, which would be indicative, like, of fatty liver disease. It would be indicative of a trauma, a bleed. We're just listening for any type of rubbing sound, which I don't hear. Then I'm going to go over here near the spleen. I'm listening for the same thing. I don't hear any rubs. I don't hear anything. And then I'm going to percuss for tone. She doesn't have an enlarged liver at all. She hasn't drank margaritas for a long time. Okay, and percussing for tone. And I don't feel any abnormal tone. And there is one trick that you can do with another nurse is you can put a hand here and a hand here, and the nurse that's doing the assessment can put the hand here, and it can hit one side, send the wave across, and you'll know if you're picking up fluid on the abdomen. Okay, so when I percussed for the span of her liver, I didn't feel any abnormality, and if she were laying in a bed, I could turn her up on her side, and I could get a really good feel under here if her liver were enlarged, and that's how that I would handle it in a normal assessment. And then blood percussion to the kidneys, I would probably do that in the costovertebral angle. And then I would ask my patient Does that hurt?
No.
Do you have any pain? Any difficulty urination, painful urination?
No.
Okay. So I've had some experience with palpating kidneys, and she had there's nothing going on there. Okay, so we would do deep palpation. That would be in the form of, let's say the chief complaint where if she were having pain down here in the right lower quadrant, which could be, let's say it were indicative of maybe she had something going on with her appendicitis. Let's say she was having some appendicitis in that right lower quadrant. When I did my palpation, I would start away from the place that I am looking at, and I would come back to that last. So I would palpate here. Does that hurt? Palpate here. Palpate here. Here, here, here. And then I would come back to that last, and I would firmly but gently palpate that. And if I get a good response there, that would mean that on initial assessment, that would be someplace we would want to zone in. Light palpation, especially in the breast area and in the nodule, what we've covered in units prior, we would be checking, like your submental, be checking all your nodes. That would be performing light palpation, and then also for these, lung sounds up in here. Got clear lungs, she stayed away from the smokes. Palpating the aorta. That's what I would do here. I would press here. You would also use, if you want to hear deep sounds, you use the bell. And if you want to hear lighter sounds, use the diaphragm. Okay, and this bimanual palpation I've already described. That would be when she's laying up on her, she would be laying on her own left side. And I did show you where I would percuss that spleen. You really want to be very careful on percussion of the spleen, because if there is, let's say that she's been in an accident and we're looking for the ford right here on her chest area, and especially in here, we want to be very careful about palpating that spleen because we don't want to rupture it. So let's go cautiously there. Okay, so, and then you got one more section here on the spleen. The spleen, obviously here, a very, very important organ. She can live without it, so we can take it out. But like I said, if we suspect a trauma within the abdomen, we need to be very careful about palpation there. Especially if she's got an AAA, we'll be very careful about how hard we push. And urinary bladder, just slightly between the umbilicus and the pelvic bone. Give it a push, and don't push too hard. Patients really don't appreciate that when you go and press really hard, especially if they can't go. So you press, and it's pretty obvious. You'll feel, it's like the top half of a softball is what you'll feel, and they'll be saying, hey, I really need to go. So this was our focused abdominal assessment, and like I said, this is Leanne. This is my helper here at Mercy, and we both thank you. Have a happy Easter.